In the clinical examination, a young man of average build and height, sitting comfortably in bed, well oriented to time, place, and person, answering my questions intelligently, had vitals of blood pressure 120 by 80 millimeters of mercury, in right arm in spine position, and there was no postural drop. Temperature was 98.6 degree Fahrenheit. Pulse was bilateral. Pulses were palpable with regular pulse at the rate of 84 beats per minute. Respiratory rate was 20 breaths per minute. He was pale with no clubbing, jaundice, cyanosis, raised JVP, lymphadenopathy, or pedal and sacral edema. In musculoskeletal examination, in the examination of hands, on inspection of both hands, redness and swelling was present in bilateral proximal interphalangeal joints and metacarpophalangeal joints. Guttering of introitiae on dorsal surface of hands, that is muscle wasting, hypothenar wasting was present. There was no evidence of pits, scars, splinter hemorrhages in nails, telangiectasia, bluish discoloration of fingers, skin rash, and no obvious joint deformities, palmar erythema, contractures, and infarction. On palpation, at the dorsum of hand, proximal interphalangeal and metacarpophalangeal joints were warm, tender, with positive fluctuation in second, third, and fourth proximal interphalangeal joints. Hand squeeze test was positive. No subcutaneous nodules on extensor surface of forearm. Coin pickup sign and key sign were normal. No sensory loss in hands and muscles grip is good, and functional status is adequate. Similar findings were present on left hand examination with positive signs in the third, fourth, and fifth proximal interphalangeal joints. In the wrist examination, there was somewhat painful active movement along anterior-posterior plane. However, it was not tender and warm. In the knee examination, on inspection, both knee joints were swollen and erythematous. On palpation, temperature was raised. Movement was restricted around knee joint due to pain. No crepitations were found. In the musculoskeletal examination of the spine was unremarkable. There were no subcutaneous nodules on external surfaces of arm. Gait was abnormal due to pain. Examination of respiratory system, on inspection, shape of chest was normal with no visible pulsation, scar marks, or stria. Chest movements were equal on both sides. On palpation, no tenderness was observed, trachea was central, apex beats were in the fifth intercostal space along the mid-clavicular line. Chest movements were equal on both sides, chest expansion was 5 cm. No vocal fragmentus was found. On percussion note was resonant on both sides of chest. On auscultation, no normal vesicular bleeding with no added sounds. No vocal resonance was found. In the examination of CVS, on inspection, shape of chest normal with no visible pulsation, scar marks, or stria. On palpation, there were no thrills or parasternal heave. Apex B was in fifth intercostal space along the mid-clavicular line. On auscultation, normal heart sound with no added sound, and no gallop murmurs were detected. Bilateral peripheral pulses were palpable, normal in character and volume. Normal vessel walls with no radioradial and radiofemoral delay. No burette on auscultation of major vessels were found. On examination of GIT, on inspection, shape of the abdomen was normal and no scar marks, stria, or visible pulsation were found. Umbilicus was normally inverted. On palpation, there was no tenderness, gording, or hepatosplenomegaly. On percussion note was normal with no shifting dullness or fluid thrill. In a central nervous system examination was unremarkable. GCS scale was 15 by 15. Sensory and motor nervous system were intact. All cranial nerves were intact on both sides.